Now students, in this video lecture, we are going to discuss a drug that is Edrophonium, which is a short-acting, indirectly reversible inhibitor of the enzyme acetylcholine esterase. Now, what is the pharmacokinetic and dynamics of the Edrophonium? Edrophonium is basically a prototype drug. It is a drug, prototype means a drug which is actually representing the whole class of the drug. By just knowing the action of the mode of action of the Edrophonium, you may be able to understand the mechanism of all other types of the indirectly acting reversible inhibitors of the enzyme acetylcholine esterase. So that's why I'm saying that Edrophonium is a prototype drug. This is basically a short-acting acetylcholine esterase inhibitor. This drug basically binds itself to the enzyme acetylcholine esterase, and this binding is actually reversible, that is by the hydrogen bonding. So Edrophonium attaches itself to the active center of the acetylcholine esterase, thus preventing the degradation or hydrolysis of acetylcholine. So now there will be no breakdown of the acetylcholine into acetate and the choline. Now what agents are blocking this breakdown? This breakdown is actually inhibited by the Edrophonium, which is the inhibitor of the enzyme acetylcholine esterase, which actually causes the breakdown of acetylcholine into acetate and choline. Now, this Edrophonium will actually block the enzyme acetylcholine esterase. As a result, there will be no degradation of acetylcholine. Now, what are the pharmacokinetic parameters of the drug? This is actually the drug which is rapidly absorbed. It has short duration of action of 10 to 20 minutes. So why it has short duration of action? Because it has ability to be rapidly eliminated from the body. So precising or summarizing the pharmacokinetic parameters, first is rapid absorption after IV administration. Now onset of action occurs within 30 to 60 seconds. So there is rapid onset of action. But the duration of action is for 10 to 20 minutes. So the exact mechanism of metabolism is unknown, but there is rapid excretion or elimination of the drug from the body. Half-life of the drug is 1.8 hours. So Edrophonium is basically a quaternary amine, and its action is limited to the periphery as it is a quaternary structure. So this drug will not be able to permeate or cross the blood-brain barrier. As a result, there will be no effect of the drug on CNS. As a result, there will be effect in the periphery, that is outside the central nervous system. Now, what is the main advantage or the therapeutic use of the drug? The main advantage or the therapeutic use of the drug is that it is used for diagnosis of a disease, that is Myasthenia gravis. Now, what is Myasthenia gravis? Myasthenia gravis is basically an autoimmune disease which is caused by the antibodies produced by our body. Now, what these antibodies do, they actually cause the damage to the nicotinic receptors at the neuromuscular junction. By these antibodies, there is actually degradation of these nicotinic receptors. As a result, there will be only few receptors available to be acted upon by the neurotransmitter acetylcholine. So, intravenous injection of Edrophonium is used for the diagnosis of the disease. Actually, what Edrophonium is doing, IV injection of Edrophonium will lead to the rapid increase in the muscle strength. So when you will inject Edrophonium into the patients suffering from MG, that is Myasthenia gravis, it will immediately result in increase in the muscle strength. So from this increase in muscle strength, you will be able to diagnose that this particular patient is suffering from MG, that is Myasthenia gravis. So what care must be taken, because excessive drug will lead towards the cholinergic crisis. Now we have two terms, Myasthenia gravis and cholinergic crisis. So in this lecture, we will also discuss the differences between Myasthenia gravis, that is MG, and cholinergic crisis. So in case of cholinergic crisis, atropine is the drug which is used as an antidote. Now, what happens in Myasthenia gravis? I have already discussed that actually in Myasthenia gravis, there is production of antibodies, autoantibodies against the nicotinic receptors at the neuromuscular junction. As a result, there will be either blockage of the receptors, inhibition of the receptor, or destruction of the receptor. Most probably destruction of the receptors. Now what edrophonium will do? Edrophonium, as we know, is an acetylcholinesterase inhibitor. It will block the enzyme. As a result, there will be startup of increased level of acetylcholine at the synaptic space. So what is going on? This increased level of the acetylcholine will try to attach itself to the nicotinic receptor. Now this acetylcholine will try to improve the muscle strength. So by improvement of the muscle strength, one may diagnose that the patient was suffering from the myasthenia gravis. So because why he was suffering? Because when I administered IV solution of the edrophonium, there was increase in the muscle strength. So what edrophonium has actually done, it has reduced the muscle weakness by blocking the enzymatic effect of acetylcholinesterase enzyme. By it actually what have done, it has prolonged the effect of acetylcholine in the synaptic cleft. Now, what this test is actually known, what is the name of this test which I have discussed? This test is actually known as the tensilon test or the edrophonium test. In this test, we actually prepare 10 milligram of the drug, 10 milligram of the IV solution of the edrophonium. Okay. We will, in the IV solution, we will have total of 10 milligram of the cholinergic drug. In the first step, we will only administer 2 milligram dose, or we will inject 2 milligram dose to the patient. If there will be no reaction within the 30 seconds, we will again administer the remaining 8 milligram. Now, ultimately, we will get improvement in the muscle strength if your patient is suffering from myasthenia gravis. So, edrophonium is the drug which is used to differentiate between cholinergic crisis and myasthenia gravis. Now, I will discuss the differences between these two diseases in this lecture as well. Secondly, this edrophonium is used to reverse the effect of non-depolarizing neuromuscular blockers after the surgery. Now, what is cholinergic crisis? Basically, in cholinergic crisis, there is overstimulation of the muscarinic receptors. This condition no doubt resembles to the myasthenia gravis. In cholinergic crisis, we have accumulation of acetylcholine. If not treated, it will lead toward the hypotension, respiratory failure. So ultimately, we have to discontinue the anticholinesterase drug as well. Now, in what happens in myasthenia gravis, there is production of autoantibodies against the nicotinic receptors. There will be same effects as seen in the cholinergic crisis, but the treatment of myasthenia gravis is the administer more anticholinesterase drug. So ultimately, we can increase the level of acetylcholine so that this acetylcholine may be able to perform its action at the nicotinic receptors. So this edrophonium, how is able to differentiate between the cholinergic crisis and the myasthenia crisis. If we have two patients, one is suffering from cholinergic crisis, other from the myasthenia gravis. Now, what this edrophonium will do? You have to administer the injection to both the patient. In case of the patient suffering from the cholinergic crisis, the administration of edrophonium will result in decrease in muscle strength. While in the case of the patient suffering from the myasthenia crisis, administration of the drug will result in improvement of the muscle strength. So now I am summarizing that what are the uses of these anticholinesterases in myasthenia gravis. Basically, edrophonium is used in diagnosis of myasthenia gravis. Neostigmine is used for treatment of myasthenia gravis, and pyridostigmine is also used for treatment of myasthenia gravis. So this was all about the uses of edrophonium. I have discussed that what is the tensilon test, how edrophonium will be able to differentiate between cholinergic crisis and myasthenia gravis. Then I have summarized that which drug is used for the diagnosis of MG myasthenia gravis and which two drugs are used for the treatment of myasthenia gravis.